In the world of cardiac medications, the battle between Entresto and Coreg rages on as they both vie for supremacy in treating heart failure. These two drugs have gained significant attention for their effectiveness in improving symptoms and reducing hospitalizations in patients with heart failure. But which one reigns supreme? Entresto, a game-changer in heart failure treatment, has garnered a strong following among medical professionals. Its unique blend of sacubitril and valsartan works to inhibit an enzyme that causes blood vessel constriction and sodium retention, ultimately reducing stress on the heart. On the other hand, Coreg, a beta blocker, has long been a trusted companion in managing heart failure. By blocking the effects of adrenaline on the heart, it helps to reduce heart rate and blood pressure, easing the burden on the heart. With both medications boasting impressive benefits, patients and healthcare providers face a tough decision in determining which one is best suited for individual cases. Factors such as patient characteristics, coexisting conditions, and tolerability all come into play when choosing between Entresto and Coreg. Join us as we delve into the world of cardiac medications, exploring the characteristics, benefits, and considerations surrounding Entresto and Coreg in the thrilling duel of heart failure management. Understanding Entresto and Coreg. Heart failure is a complex condition that requires a comprehensive treatment approach. Medications like Entresto and Coreg play crucial roles in managing heart failure symptoms and improving patients' quality of life. Entresto, also known by its generic name Sacubitril, Valsartan, is an angiotensin receptor neprilysin inhibitor, ARNI. It combines the neprilysin inhibitor Sacubitril with the angiotensin receptor blocker Valsartan. This unique combination works synergistically to lower blood pressure, reduce fluid retention, and improve cardiac function in patients with heart failure. By inhibiting the enzyme neprilysin, Entresto prevents the breakdown of beneficial peptides, which helps to reduce blood vessel constriction and sodium retention, ultimately reducing the workload on the heart. Coreg, also known as carvedilol, is a beta blocker that has been widely used in the management of heart failure. It works by blocking the effects of adrenaline on the heart, leading to a decrease in heart rate and blood pressure. This reduction in cardiovascular stress helps to alleviate symptoms of heart failure, such as shortness of breath and fatigue. Additionally, Coreg has been shown to improve heart function and reduce the risk of hospitalization and mortality in patients with heart failure. Mechanism of action for Entresto and Coreg. The mechanism of action for Entresto and Coreg differs, but both medications aim to improve heart failure symptoms and reduce the burden on the heart. Entresto's unique combination of sacubitril and valsartan works by inhibiting the enzyme neprilysin. Neprilysin is responsible for breaking down beneficial peptides, including natriuretic peptides, which help to promote vasodilation and diuresis. By inhibiting neprilysin, Entresto allows these peptides to accumulate, leading to reduced blood vessel constriction, increased sodium excretion, and improved cardiac function. Additionally, the angiotensin receptor blocking properties of valsartan help to further lower blood pressure and reduce the workload on the heart. Coreg, on the other hand, is a non-selective beta blocker that blocks the effects of adrenaline on the heart. By binding to beta-adrenergic receptors, Coreg reduces heart rate and myocardial contractility, leading to a decrease in cardiac output and blood pressure. This reduction in cardiovascular stress helps to improve symptoms and slow the progression of heart failure. Coreg also has alpha-blocking properties, which further contribute to its antihypertensive effects. Efficacy and effectiveness of Entresto and Coreg in heart failure treatment. Both Entresto and Coreg have demonstrated efficacy and effectiveness in the treatment of heart failure, but studies have shown varying results in different patient populations. In the landmark Paradigm-HF trial, Entresto was compared to enalapril, a commonly used angiotensin-converting enzyme, ACE, inhibitor, in patients with heart failure with reduced ejection fraction. The study showed that Entresto significantly reduced the risk of cardiovascular death and heart failure hospitalization compared to enalapril. It also improved symptoms, quality of life, and functional capacity in these patients. These impressive results led to the approval of Entresto as a first-line therapy for heart failure. Coreg, on the other hand, has a long history of use in heart failure management. Multiple clinical trials have demonstrated its efficacy in improving symptoms, reducing hospitalizations, and prolonging survival in patients with heart failure with reduced ejection fraction. The Copernicus and Merit-HF trials, for example, showed that Coreg reduced the risk of death and hospitalization in patients with severe heart failure. Coreg has also been shown to be effective in patients with heart failure with preserved ejection fraction, although the evidence in this population is not as robust. Safety profile and side effects of Entresto and Coreg. Understanding the safety profile and potential side effects of medications is crucial in the management of heart failure. Both Entresto and Coreg have been well studied and have known side effects that healthcare providers must consider before prescribing. The most common side effects of Entresto include low blood pressure, high potassium levels, and impaired kidney function. These side effects are often dose-dependent and can be managed through careful monitoring and dosage adjustment. In rare cases, Entresto may cause angioedema, a potentially life-threatening allergic reaction characterized by swelling of the face, lips, tongue, or throat. Patients with a history of angioedema should not take Entresto. Coreg, on the other hand, can cause side effects such as low blood pressure, dizziness, fatigue, and worsening heart failure symptoms. These side effects are often transient and subside as the body adjusts to the medication. Coreg can also worsen symptoms of asthma or chronic obstructive pulmonary disease, COPD, in some patients. As with any beta blocker, Coreg should be used with caution in patients with these respiratory conditions. Choosing between Entresto and Coreg, factors to consider. When it comes to choosing between Entresto and Coreg, several factors must be considered to determine the most appropriate medication for each individual patient. Patient characteristics, such as age, sex, race, and comorbidities, play a significant role in medication selection. For example, Entresto has been shown to be particularly effective in reducing hospitalizations in patients of African American descent, who are known to have higher rates of heart failure. Coreg, on the other hand, may be preferred in patients with a history of myocardial infarction or arrhythmias, as it has been shown to have anti-arrhythmic properties. Coexisting conditions, such as asthma, COPD, diabetes, and renal impairment, must also be taken into account. Entresto may be preferred in patients with diabetes, as it has been shown to improve glycemic control compared to other ACE inhibitors. Coreg, on the other hand, should be used with caution in patients with asthma or COPD, as it can worsen respiratory symptoms. Tolerability and adherence to medication regimens are essential for successful heart failure management. Some patients may experience side effects or have difficulty adhering to the dosing schedules of certain medications. In such cases, alternative medications or dosage adjustments may be necessary. Regular follow-up with a healthcare professional is crucial to monitor the patient's response to treatment and make necessary adjustments if needed. Case studies and patient experiences with Entresto and Coreg. Real-world experiences in case studies can provide valuable insights into the effectiveness and tolerability of Entresto and Coreg in diverse patient populations. In a case study involving a 65-year-old male with heart failure and reduced ejection fraction, Entresto was initiated after the patient experienced multiple hospitalizations despite optimal medical therapy. Within a few weeks of starting Entresto, the patient reported a significant improvement in symptoms, reduced fluid retention, and increased exercise tolerance. He remained stable on Entresto for several years, with no further hospitalizations. In another case study, a 50-year-old female with heart failure and preserved ejection fraction was started on Coreg after experiencing persistent symptoms and poor quality of life. Despite initial concerns about potential side effects, the patient tolerated Coreg well and experienced a gradual improvement in symptoms over time. Her exercise capacity increased, and she reported a significant reduction in shortness of breath and fatigue. These case studies highlight the individualized nature of heart failure management and the importance of considering patient characteristics, comorbidities, and medication tolerability when choosing between Entresto and Coreg. Cost comparison and insurance coverage for Entresto and Coreg. The cost of medication can be a significant factor for patients and healthcare providers when considering treatment options. Both Entresto and Coreg are available in generic forms, which can help to reduce costs. Entresto, as a newer medication, tends to be more expensive than Coreg. However, many insurance plans cover Entresto as a preferred medication for heart failure, making it more accessible to patients. Coreg, being a well-established generic medication, is generally more affordable. Patients without insurance coverage may benefit from exploring patient assistance programs or discussing alternative options with their healthcare providers. Consultation with a healthcare professional. Making an informed decision. Choosing between Entresto and Coreg should not be done in isolation. Consultation with a healthcare professional, such as a cardiologist or heart failure specialist, is essential to make an informed decision based on individual patient characteristics and needs. A thorough evaluation of the patient's medical history, symptoms, and diagnostic tests is necessary to determine the appropriate medication and dosage. The healthcare professional will consider factors such as ejection fraction, renal function, blood pressure, and coexisting conditions when making treatment recommendations. They will also monitor the patient's response to treatment and make necessary adjustments to optimize outcomes. Conclusion: the future of heart failure treatment and the role of Entresto and Coreg. In the exciting duel of heart failure management, Entresto and Coreg have proven to be valuable weapons in the fight against this debilitating condition. Both medications have demonstrated efficacy, safety, and effectiveness in improving symptoms and reducing hospitalizations in patients with heart failure. As research and technology continue to advance, the future of heart failure treatment holds promise for further innovations and developments. The role of Entresto and Coreg, along with other cardiac medications, will continue to evolve as we strive to improve outcomes and enhance the quality of life for patients with heart failure. In the end, the choice between Entresto and Coreg requires careful consideration of patient characteristics, comorbidities, and medication tolerability. By working closely with healthcare professionals, patients can make informed decisions that optimize their heart failure management and improve their overall well-being.